Our research topic is Ebola, and our research question is, how do we stop the spread of Ebola?
Ebola is a virus that affects your major organs, and there's 5 different kinds of the Ebola virus. There's the Ebola virus, the Sudan virus, the Thai virus, and the Bundibugyo virus, and the Reston virus. And the top 4 can be in humans and animals, but the last one is only in animals. And the symptoms of Ebola are fever, severe headache, muscle pain, weakness, fatigue, diarrhea, vomiting, abdominal pain, and unexplained hemorrhage. And symptoms may appear anywhere from 2 to 21 days after exposure to Ebola, but the average is 8 to 10 days. And people who recover from Ebola infection develop antibodies that last for at least 10 years.
Only a few species of mammals, such as monkeys, apes, and bats, have shown the ability to become infected with and spread the Ebola virus. Ebola viruses are found in several African countries. Ebola was first discovered in 1976 near the Ebola River in what is now the Democratic Republic of the Congo. Since then, outbreaks of Ebola among humans have appeared sporadically in Africa.
The past Ebola outbreaks have been in the Democratic Republic of the Congo, Gabon, South Sudan, the Ivory Coast, Uganda, Republic of the Congo, and South Africa.
Healthcare providers caring for Ebola patients, family and friends in close contact with Ebola patients are at the highest risk of getting sick because they're exposed to them. Exposure to Ebola can occur in healthcare settings where hospital staff are not wearing appropriate personal protective equipment, which is also known as PPE.
This topic was so big that we had to break it down from the local and national perspective. So for the local perspective, Casey Hickox she was a nurse in West Africa, and she cared for people who had Ebola. And then she went to our town of Fort Kent, and everyone was all scared, and they thought that she had Ebola, and people just weren't informed enough. And she had no symptoms at all, and she was self-monitored, and a CDC nurse also came in every day to check on her. And for the police blotter, from October 27th through October 30th, all of the calls were asking for information about Ebola.
On the national level, there have been 2 imported cases, including 1 death, and 2 locally acquired cases in healthcare workers that have been reported in the United States. And this map shows the 20 CDC quarantine stations around the United States that are prepared for anybody who has Ebola.
And in global, the 2014 Ebola epidemic is the largest in history. It's affecting multiple countries in West Africa, including Liberia, Guinea, and Sierra Leone.
And the Ebola virus comes from fruit bats, and so if the fruit bat bites the primate, and then the antelope eats the feces, then the father kills the antelope, and if they don't cook it enough, then the virus will still be in the meat. And so if he gets sick, then the wife will care for him with direct contact, so she might get it, and then if she picks up her baby, then the baby will get it and it'll spread it in the family.
So our solution for the local level is that to control Ebola on the local level is you have to educate the public and screen everyone who goes into the ER, and also being prepared beforehand. Like if you go into the ER and you have a broken hand, they're going to ask you if you have been to West Africa or if you have cared for anyone who had Ebola.
On the national level, our answers for hospitals, they have procedures for doctors and nurses caring for the patient with Ebola. The staff that is in close contact with the patient wears a hazmat suit, and so when they're done caring for the patient, the hazmat suit is burned, so if there's any viruses on it and it's contaminated, they can't spread to anyone else. And since there's no cure for Ebola, healthcare workers use what is called supportive care to treat patients. For example, like if a patient were to have a fever, they would give them Tylenol to bring down the fever.
And on the global level, we thought that different countries around the world could donate supplies and provide trained healthcare workers to clinics in West Africa where the Ebola epidemic is. and equipment that is used must be sterilized with bleach that kills the virus. What could be on it. All procedures are followed correctly, and nurses and doctors care for the patients in West Africa. The Ebola epidemic should stop spreading.
We interviewed, these are people we interviewed to get the information for this project. The NMSC Director of Nursing, L.A. Block, the Fort Kent Chief of Police, Tom Pelletier, and the UMFK nursing educators, Lee Pelletier.
We had a scheduled time where we would go to a 4th grade class and teach them and show them this presentation, but we had a snow day on that day. But we're going to be rescheduling it for maybe sometimes next week.
Okay, thank you.
So
You guys done?
yeah.
Okay, we have some questions.